I was really tired on a Friday. We were working longer hours because of the COVID-19 pandemic. And then Saturday, I felt even more tired, and my body felt warm. I just kept writing it off as exhaustion. So Sunday, I knew that I was really warm, and I started coughing. So I checked my temperature, and my temperature was something like 101.8. So I left work immediately. So I came to Paris on Tuesday morning, and I was tested. And by the time I got my results back on Friday, all I could do was cough and dry heave. And I had completely lost my appetite, and my body was just hot. I had a constant fever, and I had a horrible taste in my mouth and a horrible smell in my nose at all times. And my wife pretty much made me go to the hospital, where I found out that I also had double pneumonia, and I was admitted into the Henry County Medical Center for treatment.
Really, the first few days he seemed to get a little worse, actually, but we wrote him out, did prone ventilation to try to help his oxygenation out. I remember vividly him complaining of headaches all the time.
He was just pitiful. He didn't want to eat. He just wanted to lay in the bed. He couldn't breathe. He was just sad.
Honestly, I just felt like I was gonna die. I couldn't breathe, and I was coughing. I just seemed like I couldn't stop coughing, and the coughs were so painful. I never felt like I had enough oxygen in my lungs. It felt like I couldn't catch my breath.
And then finally, it seemed like just one day, he suddenly started getting better. His fever started coming down, staying down. His oxygenation slowly started improving. And then, we became hopeful that he was going to clear the virus, and ultimately he did.
I saw Dr. Carruth and Dr. Yamani every day, and I saw Dr. Finley a few times as well, but the nurses were constantly checking on me all throughout the day. And anytime I needed something, I just pushed the button, and they were right there. So they babysat me pretty well the entire time. I was pretty helpless for most of the time, so I really appreciated that.
I would devote a lot of my day to him, because he did require medicine quite frequently, and then you would stay in there, and so I would be some interaction for him. I was off a few days, and I come back, and I had him near the end of his stay, and it was a different person. It was so nice to see his recovery. He was ready to see his wife, and he was ready to see his children. It was just wonderful. It's nice to see somebody get better.
You hear testing. Anybody that's having any symptoms like this, the best thing to do is have them tested. It's a scary disease. Anybody can get it, and apparently you can have it, be asymptomatic, and give it to the next person. And that, to me, is the scariest part. The unknown. And it's so contagious.
Before I got it, I really thought that it was a joke. I made fun of it, and I wasn't even convinced that it existed, to be honest with you. So I had no respect for it. So I didn't do anything different. I didn't pay attention to the crowds. And when I was at the gas pump getting gas, I'd never used hand sanitizer or washed my hands or anything like that. I just carried on as if everything was normal. So I think my recklessness most likely brought it upon me. So just gotta be careful, and I wasn't. The Henry County Hospital is second to none. The doctors and nurses, they're second to none. Don't find that out firsthand. Just continue to wash your hands, stay away from people, stay away from crowds, stay out of public places as much as possible. Just take care of yourself and act like it's everywhere.